The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. I'm Tony Urbanek, and we're here for the next episode of TMD Demystified. Today's topic is entitled, "You Don't Have to Be a Specialist to Treat TMD Expertly and Successfully." That's the title. So I think you know what we're going to talk about. And this issue comes up because my observation and evaluation of my colleagues in general dental field or orthodontics or oral and maxillofacial surgery is that consensus is, you have to be a specialist to treat TMD. Well, maybe in the past it's been portrayed as a real complicated issue. In fact, I just purchased off of Amazon a used copy of Jeff Okeson's textbook. I'll use the name. It's his textbook. He's got a name on the textbook. I'm very familiar with Dr. Okeson's work. I think he's a very bright guy, but I will say absolutely, and I'll stick by it, and I'll justify it, and I will give documentation why it's true. It's like that textbook makes TMD extremely complicated. And he is not the only one. I'm not picking on Dr. Okeson. And he can pick on me. I'd love to have him. I would love for Dr. Okeson to contact me. Frankly, I have tried to contact him in the past and been unsuccessful. Open up a dialogue and tell Dr. Okeson what I have learned and what I've found out about temporomandibular joint disorder. And frankly, he was not interested in listening. He wasn't even interested to listen. So, okay, I got it. And he's not the only one. I'm not picking on Dr. Okeson. I just brought to my attention from my associate here, Dr. Urbina, in the practice that one of my colleagues here in town is treating, and I know him very well, my colleague here in town. I'm not going to mention his name, but and the patient came in who had been previously treated by him and described a very complicated treatment plan for TMD. Honestly, truly, if you understand the basics of what causes TMD and the domino effect of inflammation, creating all those symptoms, it's obvious that TMD is not a complicated thing to treat as long as you know what you're treating. You're treating inflammation within the joint, and if you treat inflammation in the joint and make it dissipate, then that will ameliorate the symptoms. Let me just repeat that again. If you dissipate the inflammation within the temporomandibular joint, the symptoms associated with TMD will ameliorate, go down, go away, dissipate. All right, so, and this is the message, because I want to see as many people treated successfully as we possibly can. And that's why I do this podcast, to teach and to let my colleagues know that there is a relatively easy solution. I think it's relatively easy in time and effort, in both time and effort. So I'm just going to talk about a few things regarding the topic that I chose and the title that I chose for today, because I want to really emphasize that this is not a complicated treatment and that any interested general dentist, oral surgeon, or orthodontist. If you're really interested in it, you can add this to your services that you routinely have available to treat patients and treat them successfully and expertly and successfully, predictably. So it came to my attention, I don't keep up with the throwaway journals. I try not to, but when I get a throwaway in, I always at least look at the title page, the first page, the cover, and this month's Dental Economics, which is definitely a promotional journal. A lot of ads and things in there, but they have some reasonably interesting articles. It's not science, but there are articles. And this month's topic, August topic, which just came to my attention, is the topic of this month is outshine the competition with new services. And I'm sure if you're watching this, you have access to one of these copies. And there are several articles in here that specify bringing on new services into the dental practice. And as I don't have to discuss what's going on in dentistry right now again anymore, although I'll probably bring it up sometime in the future, one of the episodes or so, but things are changing rapidly. They're changing in our culture. They're changing throughout the world. I don't want to go into that, but it definitely impinges on dentistry the same way it impinges on everyone. I don't think anyone will deny that economically, socially, culturally, things are changing rapidly in the United States of America and beyond. And that impinges and includes a lot of things having to do with our profession, which is dentistry. Or in my case, I include dentistry and medicine, which actually should not be separate professions. They should be equal, and they should be associated closely. And I did an episode or two on that fact. And if you're interested in my viewpoint on that, you can go back. But I think the time is well past where dentistry should not be included in the quote medical field, because there's so much going on around the face and oral cavity and jaws, and now the temporomandibular joint and sleep apnea, and sleep medicine for the dental colleagues, that they are super closely associated with, and the concept of being the mechanic of the mouth should be laid to rest. But that's in the past episodes. There's two. Today, I just want to comment on adding TMD as applies just to TMD. TMD should easily be added to the services that a general dentist does, if you know enough about it. And in this case, we have it taped, meaning it's organized and there overtly can be brought to your attention with our online course, which teaches how to use the Urbanic device. Here's the ad, the promotion, the Urbanic device and protocol for the treatment of TMD. And again, all you're doing by using this according to the protocol, this protocol is important, just as important as the device. You got to know how the thing works, and then you have to use it correctly as a tool. The patient understands they have to use it correctly as a tool, and you'll get the results because it decreases the load and inflammation in the temporomandibular joint, and the symptoms go away. So it's that practical and it's that simple. So that's my promotional piece. And if you're watching this and you're interested in adding the treatment of temporomandibular joint to your practice, then go on the net and look up www.tmjservices.net or call us, and we'll get you on the course and take the course, and then we'll get you licensed, and then you can treat TMD like we do around here and have just fantastic results and increase the volume of your patients tremendously. Offer a new service. It's very easy to do. So so before I forget, we'll just talk about this issue of DE, dental economics. The editor wrote a editorial note. I'm just going to, read it for yourself. If you're interested or not interested, don't bother. Adding new services benefits your practice and patients in a multitude of ways, and that's fact. But we're just talking about TMD. There are other services maybe you can add. You might want to do sleep studies, and there are oral devices, which I can, if I wanted to, speak on greatly on oral devices for the treatment of sleep apnea and or snoring. I'm not going to go there. I did a lot of that parallel to treating TMD, but nowhere near the amount of TMD services I provided. But the editor has an article on there, and probably you're all familiar, at least with the name of Roger Levin. He's has a company that does consulting for dental practices, and the title of his article in this journal is 8 Steps to Maximize the Benefits of Adding a New Service. And then I want to talk about this article just a little bit, Learning Something New, How to Incorporate Botox and Dermal Fillers into Your Practice. Again, a new service, and dentists can be qualified to use Botox. I mentioned before, I certainly hope you don't use it for the treatment of TMD, because that's bogus. All you're doing is paralyzing a muscle or two, and it's not attacking the actual problem, which is inflammation within the temporomandibular joint. And I can justify that, and I can prove that if you're interested in finding out. But Botox for cosmetic reasons, I got no problem with it. And this article is directed to Botox as something new, can be added to dental services. I'm not sure some of my oral and maxillofacial colleagues do that in their practices. I'm not going to criticize it, nor I'm going to promote it, primarily because I was a surgical oral and maxillofacial surgeon who spent most of his time in the hospital operating rooms doing major reconstructive surgeries, taking the jaw and the face and the skeletal face apart and putting it back together for various reasons. But cosmetic oral surgery is getting more and more common. And probably if I was a brand new minted oral and maxillofacial surgeon, I'd probably be doing it myself, the cosmetic part, including major reconstructive surgery. But anyway, this article, which I'll give her credit, is by Dr. Louis Malkmacher, gives the benefits, financial benefits. And I want to go over that, because there are practice and financial benefits and benefits to doing additional service. If you do it competently, you do it successfully, you are a very favorite of the patient. And I've commented many times, it is just common around here, once we get a patient out of symptoms, pain or whatever their symptoms are, fullness in their ear, ringing in their ear, that they've had for 20 years, they want you to be their practitioner. Koa, can you be my dentist? Well, no, I giggle and say, no, you do not want me to be your dentist. I have not picked up a dental drill in almost 50 years now. But I refer them to one of my colleagues who are general dentists, and they appreciate the referrals and the work. But in this particular case, this author compares the time and profit to be made from cosmetic procedures versus a single crown. I'll let you read the article itself. I'm not going to, it's not in my wheelhouse to, again, promote Botox for cosmetic reasons, but it's obvious that doing this particular service, cosmetic fillers and Botox for cosmetic reasons, is financially more successful than doing crowns, both in time used, your productive time, and in dollars collected or even netted. And that is exactly what treating TMD successfully does and promote to your practice, because it doesn't take a whole lot of time, and it is a wonderful service because it's predictable and takes away symptoms that have been, for some patients, misdiagnosed, mistreated, misdirected for 10s or 20s, 30 years. So it's in the mainstream right now. So many new dentists, so many doctors are looking to expand their practice and thinking about, well, maybe new services would be the right thing to do. Well, I encourage that regarding TMD. Not sure I encourage that for the general dentist regarding cosmetic procedures, but we'll see how all that plays out. But regarding TMD, that is definitely in our wheelhouse as dentists, because the physicians don't know or don't want to know anything about it. The ENT doctors don't know or don't want to know anything about it. They consider it is the dentist's prerogative. And like hundreds, if not thousands of patients have come in and they said, well, I went to my ENT doctor for my earaches, and I went to 3 ENTs, and finally the third one says, I think you have TMJ, you need to go to your dentist. If I heard that once, I have heard that 1,000 times. I've heard that 1,000, no exaggeration, times. So the TMD is in our wheelhouse. Now, whether you want to treat it or not, that's up to you. It truly is, and it isn't for everybody. If you have no interest in it, and if you are totally happy with what you're doing and you got everything set up, well done. But we are actually promoting and looking for doctors who want to add this service to their practice for their well-being, and also more importantly for the patient's well-being. Because again, I've commented almost on every episode, one way or another, these patients are being they're well underserved, misdiagnosed, mistreated, misdirected, constantly. Again, I mean, I don't have to go back a day or two. I had a conversation with my associate, Dr. Urbina, not 30 minutes ago, and he went on to tell me a patient had been in and she had gone through orthodontics. Orthodontist told her that the orthodontics was going to treat her symptoms, and then she went through a series of splints by another doctor who is a TMJ specialist in this area of Middle Tennessee, holds himself out to be a TMJ specialist. You don't have to be a specialist, you just have to know how to treat it. But obviously not effective, because she's sitting in our office asking for help. And that's the way it goes. That's the way it's been going since I've been a young dentist in dental school. Talked about that all the way up through all my experience doing 2,000 temporomandibular joint surgeries, which I finally gave up doing that and figured it out. So it's in treating TMD, you don't have to be a specialist. You just have to know and understand a few basic concepts of cell biology having to do with inflammation, and a little bit of anatomy, which I'll explain to you. I'm an anatomist by training, extra training in anatomy and degrees. And but you don't have to be an anatomist. It's all in the course, and it's all available to look at and understand. And once you understand it, it's like anything else, you cannot see it. Then once you see it, you can't not see it. And then you can treat it effectively, and a few nuances about using the device. It's a tool, and once you and the patient understand how to use the tool, then the results are very predictable. And again, I'm not going to repeat myself. I encourage you to look on some of the other episodes. That's why they're recorded, so you can go back and see what I said about these issues. So adding new services is becoming more and more common and needed and wanted. And definitely as competition heats up between independent dentists and dental practices and dental service organizations and corporations that coalesce multiple practices together, and actually there are benefits to both methods. I don't actually claim one is going to overtake the other, except that what I do see is that dental services organizations have a big advantage as far as capital and organization and things like that. And I think the statistics prove it, but the point is, Independent dentist, there's an advantage to that. But once you are well trained, and once you are well schooled, and your ability is in doing all of the more complicated issues in dentistry, 3-rooted root canals and wisdom teeth, if you even try to do those, which as an oral surgeon, I've had a lot of experience with my general dental colleagues taking out wisdom teeth, and the average oral surgeon takes 20 minutes to take out a wisdom tooth under IV sedation. Patient doesn't know or remember anything about it, and it's quite a different story with our general dental colleagues. So this is something you can replace that issue with, or that desire to be the surgical specialist. You can actually take on TMD. It's very remunerative, just as remunerative as surgery would be, or more so. And you're providing a service that really benefits the patient, just tremendous benefit to the patient. So, and you don't even have to call yourself an expert, although it does give you a niche that you can promote. Nothing wrong with promoting your niche and that you're really good at, and let your patients speak for themselves. Let your success story speak for yourself, which brings me to the point of not only once I figured out how successful it was to use a proper, simple device and protocol, then I was really stressed to figure out how to get it out into the public, and we learned how to promote it. And again, touched on many other episodes in the past, several other episodes in the early past. It's like you promote it to the doctors who are well-meaning doctors who misdiagnose it, misdirect it, diagnose it, misdirect it, mistreat it. And there, everybody wins. The doctors who have misdiagnosed it, they don't want to misdiagnose. They don't want to miss a problem. They're there to help people, whether you're an ENT doctor, a neurologist, a PCP, a walk-in clinic, a physician's assistant, nurse practitioner. If they knew exactly what to do, they would do that. And TMD is one of the things in the medical profession is totally not understood, not even misunderstood. It's not understood and not wanted. So it's a win-win for everyone. It's obviously a win for the patient, and obviously a win for the practitioner who does it correctly, does it efficiently, does it rapidly. It's a win for that practice. So everybody wins. Everybody wins if you know the basics on treating TMD. That's enough for today. I encourage anyone who is listening to this episode or any other episodes that I produce for TMD Demystified and Dental Town, if you have questions about what I say, contact me. If you would like to criticize what I say, contact me. Leave a comment. I will answer your comment if you leave a comment. I'm here to help you. I'm here to help patients. I want to see this problem solved throughout the United States of America and beyond. Just because we have a business that licenses other doctors to use this device and protocol does not mean that I am not devoted to the patients and that I am not devoted to solving this problem. Because my wife says I should be retired playing golf, except I don't play golf. I fly airplanes. All right, enough for today. Please leave a comment if you wish, and please contact myself or Naomi, who is our Director of Marketing and Education, if you'd like more information, if you'd like to be licensed, if you'd like to come and visit beautiful Nashville, Tennessee, walk up and down Broadway and have a beer and visit with me. I'll take you to lunch, and we can enlighten you on how you can help your patients and your practice at the same time. I am Tony Urbanek, and this is TMD Demystified.